This is a very wonderful panel. Thank you all for sharing these stories and for contributing such a variety of experiences, and also your deep understanding of the issues, as well as your push for testing and monitoring. So in fact, I want to open with one question that I will give you before turning it over to the panel, which is, if you have seen guidance documents before from any sources, what are the strengths and weaknesses of those? And what would you like to see in terms of not just guidance about monitoring and information, but general education for health professionals? So that's my question to the panelists, and I'll open up to them now.
Well, Dr. Brown?
Go ahead.
All right. Kathy Woosterbarth here. Actually, I pulled out a summary of what Andrea Amico does review the science and human health effects of PFAS. The general tone seems patronizing and dismissive. It does not support the need of impacted PFAS communities, which are access to blood testing and clear-cut medical monitoring guidelines. And it does not address how ATSDR plans to implement education to providers in PFAS communities. This document alone will not provide education for providers to make informed decisions.
In case other people don't know, Andrea Amico is one of the co-founders of Testing for Ps in the Portsmouth, New Hampshire area, and a leader of the National PFAS Contamination Coalition.
And Dr. Brown, she submitted 8 pages of observations about that document. So that was had something to do with this study that we're in right now, so that we could develop a better document.
We just jump
Other
right
panelists,
in?
Go ahead, Samara.
So I think I think, as I've reiterated before, that there's a need for not just immigrant populations, but the public in general. We need something that has plain language on those kinds of on any sort of dissemination. And if it's going to medical experts, there has to be something that they can provide to patients as far as resources, or what they can do. For example, is there a certain type of home filter that they could install? What practices that they should do if they come in contact, or what if it's safe to see, to touch it or swim in it or shower in it, those kinds of things provide the public with the resources and the information on how to prevent more contamination in their households or in themselves.
Okay. If neither of the other panelists want to respond to that, I will then turn it over to the members of the NAS panel, and we'll start with Jane Hoppen.
Thank you all for interesting presentations today. I was particularly interested in the last presentation about how you described that you set up a lab in your community. How does that work? Because I know that lots of communities are challenged with how do you get a blood test. Could you comment a little bit more on how you got that set up and how it's utilized?
Certainly. Yeah, we're very we're very blessed to have a local chemist who also is a brewer, by the way. So he has a chemical company, and noticed all of the scientists, geologists, toxicologists just coming through town. And he said, and the they were reporting they had 3 weeks that they were getting these PFAS testing results. You know, it took them 3 weeks to get these tests back. And he said, I think that I can do that. So he took that business opportunity and got it, you know, purchased, invested into that lab himself. So he's in the process of doing environmental testing at this point, and we'll be moving towards tissue testing. But he just found the opportunity and set it up.
Is he reporting back blood results now or not yet?
No, he does not. He's not able to do tissue testing at this point. So just environmental.
Cool, thank you.
Mhm.
So if I can add to that as well on the environmental side, one of the things that we discovered is that the University of Michigan, Ann Arbor had a lab, and normally it's very expensive to test your water, but the U of M Ann Arbor has a lab where, you know, they send you a kit, you can do your own sampling of your well water or your home water and send it back for testing, and it'll give you some sort of result that's close to letting you know as far as if your water is contaminated or not. And the reason I bring this up or mention it is because I just want to provide that there are options available, low cost options available if somebody can't afford, testing of their environment through a formal lab. But nonetheless, regardless, I think that medical experts have to also know the places that are contaminated, that their patients live in. They have to know these things. And one of the things that Michigan has done that's good is set up the MPART website that shows different people it's a public site. It shows you where the contaminations are in Michigan. And I think that would be a great resource to have for medical experts as well.
Thank
I'm
you.
not sure if the lab reopened. Somebody asked that question.
Thank you. Let's turn to Erin Haynes.
Great. Thank you, Phil. And panelists, I really appreciate your testimony. It's really touched my heart and mind in thinking about the experiences that you've gone through and your bravery and courage and persistence for sticking with it. I have a question for you about physicians. So the physician's a primary target of information, a source of information. I'd like to hear your thoughts on when you visit a physician, what would you expect them to be able to respond to? What would be your expectation from your local physicians? Besides just that they don't move around so frequently. That was an interesting comment from Andy.
If I could go, sure. What I'd envision is, communities like the ones that these presenters are coming from today, that obviously they're identified as having exposure through various sources, but those practices in those communities make an effort to have, first of all, information, in the actual office about exposure to, whatever chemicals might be applicable, but that the physicians, of course, be educated on that potential exposure in their community. So handouts are good. I mean, just things like that. And also partnering with or making sure that we attempt to talk to the actual companies, these companies, the medical companies in say for instance, Michigan, they're conglomerates, right? We have Ascension and we have, all these conglomerates that they have buy-in in terms of making sure that environmental exposures are important things to address.
Laura? You're muted.
Just like there's
Okay.
screening techniques for looking at your medical history, looking at your family history, and that would become part of a regular screening when you go in for health, because a lot of people don't know what PFAS is. Some people don't even know where their drinking water comes from. What is groundwater? So having some kind of standardized questionnaire and advice, and then resources available to physicians. right now we're relying on people to find out themselves if they can. And as I spoke about before, getting access to information to actually document your exposure and what risk you have is almost impossible unless, except in the case of a drinking water supply, that you consumed that water for a period of time. But and then also just being more open to it, the training that physicians, because I've listened in on those trainings, and it's like, don't gather that data because you're not going to be able to treat them and you're just going to scare the patients. And I think, to me, what's more scary is not knowing and not having the tools to get the care that I want. That's my 2 cents.
I'd like to see a general approach of more information is better. I think it's incredibly frustrating, even just trying to find out. When we first became aware of this, we tried to reach out and find places that would actually do the blood testing. And that was challenge number 1. Challenge number 2 is once those results came back, who can interpret them? So if not all physicians understand how to interpret them, that's understandable. But then those physicians need the resources of who should they be going to for interpreting these results, and what can they do with the information once they have it, as well as specifics on patient care and what should patients be looking for and how should they be addressing. And I'm sorry if I'm repeating myself, but it seems like it never sinks in when I talk to DHS. Just think about the BRCA test and the usefulness of that. It's not scary. A lot of people want that information. If you know that because of your exposure to PFAS, it's elevating your risk for some of these diseases, teach us what the signature is of when you start to have a thyroid issue. What should you be watching for? And especially in these areas, where we know that the communities have high contamination, so that they have details. I read through the guidelines that you guys had listed, or the proposal, and like the gal from Now said, it's too generic. It doesn't give us any real information. And because all of this revolving around PFAS is so hard to find reliable data on as it is, I'd like to see some sort of network to streamline actual, credible, factual, scientific data that can be shared to the public. And I know it sounds like a lot, but I really don't think that it's something that can't be achieved.
Okay, thank you. Let's turn now to Kevin Elliott.
Yeah, thank you all so much for your presentations. I really appreciate taking the time to share with us. And my question is kind of inspired by some points that Sam made, but I think others of you might very well have thoughts on this. You mentioned, Sam, how your community is already exposed to a lot of other pollutants. And I was wondering, as we think about strategies for testing and screening and monitoring, if you think there are any good models with these other pollutants, you mentioned lead, in order to kind of learn from what's been done for communities in those cases. And, Kathy, you provided some really concrete suggestions. I didn't know if you had been inspired or guided by any other examples with other pollutants and the kinds of testing and screening programs that has been done with those. So I don't know if any of you have thoughts on that.
Okay, so I guess I'll jump right in. You're asking if there's a model for like screening patients, okay. So I don't know of a model that's out there right now. I can give you an example that I know that is working with a different kind of contaminant, and that would be with lead. Considering that most of these people are low income, they do apply for like WIC, women, infant, and children's benefits, and healthcare through Medicaid. And that program actually requires them to bring their kids in once or twice a year to get lead testing. And so that is actually a very effective way of the community, the public, finding out that, there's a high amount of lead contamination going on in this community with these children. If there wasn't that kind of requirement to receive this benefit, I can assure you that none of these people would get their kids tested for lead. So that's a good model per se, but I'm not aware of something else that's in place right now that could have people like go out there and get tested. I don't even think that their physicians, if I was to call my physician, that he would be aware that this is a contaminated site, and that, you know, I potentially have some of these things that I'm ailing from are probably from that.
I'd like to tag on there just briefly is in the case of AFFF foam, 20% of the foam actually is solvents. And so in addressing PFAS, I think this more comprehensive look is there's going to be other exposures associated with that. PFAS isn't the only bad boy in there.
I have one more thing. I recall, you know, going into, you know, just for a general checkup or whatever, into a doctor's office, and they have depression screenings, and then they also ask about the safety of yourself and in your home, in terms of highly polluted areas like ours. Adding that on, you know, do you know what the source of your water is? You know, a simple question like that might be an option.
You know, that's a really good point too, because when we talk about going to the doctors, and the first thing they give you, if it's a, you know, as a new patient, is they give you a questionnaire that says, you know, have you had cancer in your family? Have you had X, Y, and Z heart disease in your family? And it's unfortunate because, you know, PFAS can be transplacental and moved on, you know, passed along through breast milk and whatnot. And it's essential, I think, to have that question added to these new patient questionnaires, to see that, you know, this is something that could have been passed on to the patient without them necessarily, you know, knowing. Did that answer it?
Thank you all.
I'm sure
for good suggestions.
there are many answers to this. Those are very good additions. Other members of the NAS panel have questions.
I think
I
next
do.
is Chris. And then Melissa.
Hi, thanks for your presentations. This is, it's all very interesting to hear from people actually on the ground who experience this on a daily basis. It certainly makes the issue real. I'm curious about the public water supplies. So these aren't the people with private wells, but those in community supplies. And community water suppliers have some obligations to report. And like the consumer confidence report that reports on regulated chemicals, and this obviously isn't a regulated chemical, but do you get any feedback, any data from your community water supply about the levels of PFAS in the water, and any subsequent follow-up that, because they surely know that this is a contaminant of interest, both in the community and in the regulatory community. So I'm just curious if there's any engagement at all with public water supplies in any of your communities.
I'll push here for very quick responses because we have only a minute and a half left, and want to make sure that Melissa gets to ask her question.
I've been to multiple water department meetings in my community. We know that our water comes from the Bay of Green Bay and that the plume is moving outwards. So the levels in the bay are increasing. Right now the intake is about 5. And by the time it gets to our tap water, it's at like between 2.5 and 3 parts per trillion. And when I went in to ask the water department to start looking at potential filtration systems so that it wasn't a delay, because we know that these are going up, right? That it's not going to go down. And so when it gets to the enforceable level, or when studies come back and we reduce the levels of recommendation for Wisconsin, I want to be prepared. And I was told point blank, there's different filters for different PFAS. We'll never get them all, so we're not going to do anything. Another meeting that I was at, the water department head, who doesn't have any formal training or scientific background whatsoever, but worked his way up through the facility to water manager. He made the comment when people were asking about testing, and he made the comment, you have to be careful what you test for, because if you find it, you have to disclose it. So that's the attitude in my community about testing the water from the people who are in charge of it, and it's horrifying.
Liz, can we go over like a minute just so Melissa can ask her question and get at least one panelist response?
I would think so.
Melissa, go ahead.
I think Kathy still had a response for that last one.
Oh, no, we do testing of our municipal water supply, and it has come from Lake Huron, and it's within, it's good right now, so.
All right, well, my question may be brief. I was curious, Andy, about something that you mentioned with regard to PFAS being distributed across agricultural lands. Could you just tell me a little bit more about what type of agriculture is taking place on those lands?
Yes, so we have thousands of acres that have been that had tons of gallons of biosolids spread on them. They are in fields that are not fit for human consumption, but it is going directly to the animals. One of the largest, so in order to figure out where this was, I actually took the coordinates given and mapped everything out. And so it's repeat spraying on the same fields over and over again. And one of the worst contaminated areas is actually a CAFO. So they're growing crops and feeding them to cows. We can't get the Department of Agriculture to do any testing. And when we ask the DNR for help, they tell us it's not their department because it's agriculture. So we are sending all of the cattle every couple of weeks, tens of thousands of pounds of beef to JBS in Green Bay, where they're being processed and going into who knows what foods. So for all we know, it could be going into the lunches that we're serving the kids at the schools. It could be going into your TV dinners. We really have no way of knowing where this is. And so anybody that thinks they're not affected by PFAS is dead wrong, because Wisconsin and our area has dairy production as well. We're contributing it through poisoning you through the food supply, and nobody's testing for it.
Thank you.
Thank you.
Thank you for that. I know there's a lot more that we could say. We've kept ourselves mainly to the time. We're about a minute or two over. So thank you so much to the four wonderful speakers for their incredible stories. And as Erin said, their bravery. And thank you to the questions that we got from our members. So we'll end this panel right now. Thank you all.
Thank you.
Thank you. Thank you, Dr. Brown. And I want to add my thanks to the panelists. It was a great panel.